Hi, this is DrJenniferStebbing. I'm so happy that you're looking at this video. This is a further informative video on back pain, and I'd like to talk to you about causes. There are many different causes for back pain. The most common cause is probably called mechanical back pain, and there is no x-ray changes with mechanical back pain. It's pain that's caused by movement. And for this reason, we usually treat people with physical therapy, chiropractic, acupuncture, and other different types of modalities that are aimed at strengthening the core, which includes your abdominal muscles, part of your psoas, and multifidi in the back, and some of the other smaller muscles that help support it. The back is made up of so many different bones, and that's the reason why the pain can be varies in severity. For example, when you're out of alignment, that can cause discomfort. Additionally, if you have a disc problem, or the disc slips forward, that can cause a lot of pain in some people. So the question is what's causing the pain? And because the back has so many different bones in it, there's a lot of room for something to go wrong. On one hand, it allows us to have the flexibility so that we can bend over and bend backwards and side bend and rotate in a whole bunch of directions in the low back. This is an incredible advantage that we have. However, because each of those areas move, there's a potential injury at each attachment from one vertebrae to the next. The attachments that are joints are called facets, and the facet can develop arthritis. When arthritis occurs, it's actually indication that the ligamentous structures that hold the spine together are a little bit lax. So what happens is you have additional movement from one vertebrae to the next, and this can cause the facet to widen as your body tries to stabilize it. So your body's very smart. It says, how can I make this a more stable joint? What I'm going to do is I'm going to lay down calcium, make the joint wider. And when this happens, what can occur next is that it can make the space between the nerves where they exit smaller. And this is called a foraminal stenosis. And when this happens, you can get pain that goes down into your butt or into your leg that is as a result of the nerve being compressed. Additionally, if the disc is affected, meaning that the disc is held in place by these ligamentous structures or these capsular structures that hold it in place, and if you have, for example, whiplash injury, or your biomechanics are such that over time you get an overuse injury that creates the disc to slide forward or backwards or partially to the side, the disc can cause compression on the nerves or onto the spinal column. And when that happens, we get a condition called spinal stenosis. All the literature suggests that if we wait, your body does a good job of trying to fix itself over the course of a year. But sometimes people, in their haste to get out of pain, and may not be unwarranted, they pursue surgical options. And when this happens, depending on the type of surgery, you can get further decompensation of the spine over time. So understanding where that there are different causes of pain in the spine is important and can be evaluated by MRI. When we talk about the different causes, then we direct treatment accordingly. For example, we know if the spine is stiff or tender with rotation one way or the other, we may have to use a little bit of manipulation to get those facets so they're moving better. On the other hand, there may be some soft tissue injury, for example, an injury to the muscle that may cause pain right there because the muscle just then can't do its job properly. Under ultrasound, we can sometimes see these defects or these areas where there's tears in the muscle or tears in the fascia, and we're able to treat those simultaneously. With what do we treat these things with? And that's a great question because sometimes the trigger points can easily be treated with an acupuncture drawing needling. On the other hand, if the trigger point comes back again, it really suggests that the spine is hypermobile and the muscle tightness that is occurring and the trigger points that are occurring are in direct response to trying to stabilize that spine. In that case, prolotherapy or PRP can be used to help repair or heal the ligamentous structures or the capsular structures that surround the spine. And there are quite a few of them. For example, the supraspinous ligament can be injured with whiplash. Interspinous ligaments can also be injured with whiplash or any flexion or extension injury. The facet has a capsule around it. They have pain fibers in that. The muscle itself can be injured. And there's ligamentous structures that we can treat on the backside of the spine. In addition, there's a huge role for physical therapy, which is geared towards getting the back strong. I like massage. I love acupuncture. I like chiropractic. I'm an osteopath. I do manipulations. And we know that there's also probably a psychological cause of pain that can be treated at the same time. The thing about mechanical back pain is that if we don't treat it, what happens is the injury gets worse. So many times people come in and say, oh yeah, I've had days where I've just had to lie on the ground for 24 hours. And after that, it gets better. What happens over time is that there's more days involved, it takes longer to recover, and you get more days lost from work. This is an ideal time to treat with prolotherapy. And once the disease has progressed more, then you start to get arthritic changes in the joint, and you may end up having larger muscle tears and other things, in which case the PRP becomes really important in terms of treatment. If there's disc disease or if there's bone marrow changes and things like that, that's when stem cells and other higher level of options exist. And although I don't treat these specifically, I have colleagues across the country that I know that do a great job with treating disc disease, and I can help refer you to that if that's what you need. In the meantime, a very nutritious diet with lots of fruits and vegetables is important. Supplements such as vitamin D, lots of minerals, fish oil, and probably there's a role for glucosamine in there as well. It can help improve your healing. Obviously, avoiding smoking and drinking alcohol plays a benefit in terms of your overall health. And exercise every day is really, really important. You don't have to run. You can do non-weight bearing exercises if that's all you can tolerate, which includes pool work or exercise bicycle or an elliptical machine. You don't have to do weights. There are other ways to get your abdomen strong. The side effects to prolotherapy and PRP have to do with where the anesthetic and also where you're injecting. You have to make sure that your needle is in the right place. And for that reason, ultrasound is very important in terms of guiding treatment along the way. The following video was going to be about prolotherapy, and if you want additional information about PRP, there's a video on my website that you can look to get general information about that all. Thank you for listening to the video. This is Dr. Jennifer Stebbing. Please email me at info@drstebbing.com if you have any further questions. Thank you.